In today's Health Watch, we are taking a look back at President Jimmy Carter's legacy in the field of global public health. After leaving the White House, Carter worked for decades to eradicate tropical diseases across the world. In Africa, his efforts helped nearly eliminate a devastating infection called guinea worm disease. He also pioneered new approaches to train healthcare workers, distribute medicine, and advocated for better mental health care for all. Our chief medical correspondent, Dr. John LaPook, interviewed the former president in 2007 for CBS Sunday Morning. Here is what he said about the work of his nonprofit, the Carter Center.
That's right, that's true. When Rosa and I left the White House, we didn't know what we were going to do with our lives, and we have been really blessed by the evolvement of the Carter Center. We now have programs in 71 nations on earth. Just a few days ago, I was in Sudan dealing with some of the most horrible problems on earth with a great deal of hope and expectation that in a small way we can join with the phalanx of other well-meaning people and bring about a better life for everybody.
Dr. John LaPook is here. Doctor, good morning.
Morning.
So we've talked ever since, really for years about how Carter's legacy really was, so much happened after his presidency, so much during his presidency, but really after his presidency. And put into context his true impact on global health.
It was enormous. He cared about the little guy, and he used his power to plug holes. So some country needed something, he'd pick up the phone and call the president. The president didn't respond, he'd get on a plane and fly there, and then things started happening. There was a condition called...
Really? He would get on it, he would just
he would just boom, and then he walked in the room and go, okay, we're gonna do that. River blindness, big condition, and Merck very generously donated the drug, ivermectin, to take care of it forever, for free. But they couldn't get it the last mile to the villages. Carter Center stepped in. When Bill and Melinda Gates were starting their foundation, they turned to President Carter and said, can you help us figure out how to deal with tropical illnesses? And he gave them advice. And then, of course, you heard about guinea worm and helping to eradicate that.
So it's difficult work, also very rewarding work. And you talked to President Carter about both those subjects. Take a look at the answer.
When we started with guinea worm, quite often the witch doctors there who were looked upon, they were the actual doctors, didn't want us to interfere in the local water holes where the guinea worm eggs were breeding, and the people were drinking the water, and a year later they had a worm in their body 30 inches long. It took 30 days to emerge. And so we had to convince the villagers to ignore the witch doctors, at least in this case, and let us correct the problem. We didn't correct the problem. We taught the villagers how to correct their own problem. There are many people on earth that are suffering completely unnecessarily. And just with a small amount of attention and generosity with our time or with our money, we can alleviate their suffering. What you invest in improving those lives will pay you much richer dividends than what you put into it. You get more out of it than what you put into it.
Like all things.
Yeah.
I love that.
Yeah, it's a beautiful thing. So do you happen to know how he settled on this lifelong effort to just alleviate suffering? It's so simple, so beautiful, and so successful.
Well, it reflected the decency of the man. I mean, that really came across. I got to spend a half hour with him. They were going to give us 10 minutes, then it went to 30 minutes. And that really came across. And in terms of the guinea worm and the use of power, in 1995, he brokered, there was, of course, a civil war in Sudan, and he brokered the guinea worm ceasefire for 6 months.
Really?
Which was amazing. And then he used his power to do that. And then they were able to come in, clean up the water, which was the main problem. And in 1986, there were 3.5 million cases of guinea worm, very painful disease. And at last count, in November of 2024, 11.
Wow. So, Dr. LaPook, you had time with him in the room. What surprised you? What stood out to you about being with him?
What really came across was his sense of decency. You know how you look at somebody and you can tell he was an intent listener, very curious, very detail-oriented. When I came in, he was reeling off the names of things. You know this, we're dealing with schistosomiasis and trachoma and guinea worm disease, and I said, is this guy a doctor? But he's known for that, doing the deep dive, and then he would come up and he would really have a sense of mastery. But really, his sense of decency, his caring about the little guy, and what a pleasure and an honor to meet him. And I have to say, last night I looked at the whole 30-minute interview and it was like, wow.
Yeah. The smile as well. One of the buttons when he was running for office was the grin will win.
Oh,
the grin did win in the end. Yeah.
That's so good.
Dr. LaPook, thank you very much. Appreciate it.